Good morning. My name is Erin Hamel, and I'm an assistant professor in communication sciences and special education. And my PhD is in human sciences, specifically early childhood education. And so today I'm going to share with you my work on the early childhood workforce. And so what we know in early childhood is that young children's relationships with their caregivers is critical to their development. And so we need adults in young children's lives to be reliable, positive, responsive, sensitive to them. And with most American homes having dual income families, both parents are working. And early childhood teachers fill that role for young children throughout the day. And so it's important that we have high quality work supports for early childhood teachers. Work supports are things like reliable breaks, having a substitute teacher available to take time off, and paid planning time. And so today I'm going to share with you some of my work on paid planning time specifically. My work also aims to elevate these work supports for early childhood teachers because when they're stressed, they tend to respond to children in less positive ways, they're less sensitive, and have less patience, which can impact their interactions with young children. When they're also stressed, we see higher burnout and turnover, creating essentially a rotating door of temporary teachers for young children, which is contrary to what we know is important for children's development. And so I'm going to show you a figure from a study where we looked at early childhood teachers' motivators for entering the field, and you can see them on the left, and then the challenges that they reported on the right. And early childhood teachers reported that if they had more challenges, they were more likely to not only leave their program, but to also leave the profession. And prior to COVID, we had an early childhood teacher shortage, but COVID has also exacerbated that, and many areas of the United States have what we call a child care desert, where children do not have access to high quality early childhood care. The aim of my research is to tilt the scales, and so that teachers have the work supports that they need. They at least outnumber or balance out the challenges that they're facing. Along those same lines, with the motivators and challenges, we've gone in and asked teachers specifically because their voices tend to be unheard in the literature. Like I mentioned, I'm going to talk about work support specifically, but one is paid planning time. So planning time is the time of day when early childhood teachers are scheduled to be away from the classroom so that they can work on their work responsibilities like assessments, planning lessons, communicating with families. It's a time when they're supposed to be free from their responsibilities to care for, educate, or supervise young children. And so that's the time we're going to look at today. I asked teachers, early childhood teachers, how much planning time that they're allotted or intended to receive, and then what they actually get. And so we see that they are allotted more than they actually receive. And so this was statistically significant. If they were allotted more time, they received more time, but due to the flexibility that's required in teaching, lots of times their schedules were interrupted and they weren't given the time that they were actually allotted. There was also a relationship between the type of program where teachers are employed and how much time they're getting. So we can see if an early childhood teacher is employed in a public school, they're getting the most planning time at about 5 hours a week, so about an hour a day, compared to the least amount at for-profit national chains at about an hour and a half for the entire week. But it's important actually to look at the range as well. So we can see some teachers reported 0 planning time and others reported as much as 900 minutes, which is about 15 hours a week, which I attribute to infant and toddler teachers who consider that the child's nap time is kind of their time to do their planning. But we asked teachers because we wanted to know what's their perception. Is this enough time for you to get your work done? And most of them said no. Less than 10% said they had enough time. But notably, over 40% extend their work hours by coming in early and staying late. This is really problematic for the early childhood field because they're already underpaid. And so asking them to extend their work hours is detrimental to their job satisfaction. They also reported using their personal breaks and lunch to do the planning. And then lastly, they've reported completing the tasks during their personal time, such as in the evenings and the weekends, which again can attribute to burnout with teachers. And so this led to a question about what are teachers actually doing with the limited time that they have, and how do they prioritize the many obligations and work requirements. And so a current study that I'm working on is going into early childhood programs and observing their planning time practices. And so what I found from that preliminary result is that early childhood teachers are not getting the time that they're scheduled for. They're receiving less. They're also planning under not ideal conditions. So they're planning in the dark. Some of them report using their own personal laptop because what was provided to them from the school was not working. And then probably most surprisingly is one teacher reported that she routinely used a crowdfunding source to get the materials that she needed for her classroom to be able to do her job. And so the goal of my work is to elevate teachers' voices and to find out this information and share it, distribute it so that people understand the working conditions, that we can help to inform policies at a program level, but also at a state and hopefully federal level, so we can change and elevate this workforce so that they can sustain and help us address the early childhood teacher shortage. And I'll take any questions that people have.